at Haji. Okay, so before I jump to the detail, here my presentation outline. Starting from the introductions, where I will include a research background and problem statement, followed by objective, methodology, and I will show the key finding of the research. Okay, for the introductions, abnormal uterine bleeding is one of the most common gynecological conditions in women of reproductive age. AUB is described as menstrual complaint in the regularity, frequency, durations, and volumes that occur outside pregnancy. Acute AUB can be interpreted as heavy bleeding that requires quick treatment to prevent blood loss. The International Federations of Gynecology Obstetrics divides AUB's causes into the main categories according to the acronym PALM coin, which are polyps, adenomyosis, leiomyoma, malignancy, and hyperplasia, coagulopathy, ovulatory dysfunctions, endometrial, iatrogenic, and also not classified. In general, the palm group is a structural component that can be measured visually by imaging and or has pathology, while the coin group is a non-structural component, which means it cannot be measured by imaging or histopathological techniques. So the incidence of leiomyoma is estimated to occur in 70 until 80% of women aged 40 years and older. Leiomyoma is also known as uterine myomes and uterine fibroid. Leiomyoma is a benign tumor in myometrial muscle cells and connective tissue. Generally, women with leiomyoma are asymptomatic. However, about 30% of them will show severe symptoms, including AUB, pelvic pain, back pain, constipation, frequent urination, until infertility. Haji General Hospital is a place for education, research, and health services, and is a referral center for the North Sumatera region and surrounding. So disease can be reflections on the public health conditions, especially on women gynecological health and in North Sumatra. Research linked to the characteristic therapies and type of actions is still minimally carried out. This research was expected to be reference that add insight for both women and healthcare providers to find out about and deal with AUB incidents earlier. This research was descriptive study with a cross-sectional designs to determine the characteristics and also managements of AUB event in Haji Malik General Hospital. The study used retrospective data in the form of medical records. This research sample was selected using total sample method, where the sample was medical records diagnosed with AUB for diagnosis in period 1st January 2020 until 31st December 2021, which met the inclusion criteria like patients with a complete and eligible medical records that include variables to be studied such as age, body mass index, marital status, education level, menarche age, parity, palm coin classifications, therapy, and also type of actions. Okay, the number of cases of abnormal uterine bleeding at Haji General Hospital in 2020 until 2021 was 224, and those that met the inclusion criteria were 197. 27 cases fell under the inclusion criteria, such as multiple diagnosis like pregnancy, like HIV, uterine prolapse, heart disease, liver disease, and etc. And complete medical records like interpretations of ultrasound test result, menstrual history, pregnancy history, body mass index, and etc. And women with AUB aged 41 until 50 years had the highest percentage in 42.6%. The increasing of prevalence of IUB in the age of group of 41 until 50 years may be due to the fact that when women approach menopause, there will be a decrease in the number of afferent follicle and increase a resistance to gonadotropin stimulations, which can lead to a decrease in estrogen levels so that the endometrium cannot be maintained in its normal growth. The occurrence of high prevalence of leiomyoma at the age of 35 until 50 years is due to estrogen levels decreasing before menarche and increasing during a reproductive age. The American College of Physician Gynecologists recommends that women over the age of 35 who have the abnormal uterine bleeding perform an endometrial examination by biopsy. This is because women's risk of developing endometrial cancer is increasing along with age. Okay. Women with AUB had a lowest BMI had the highest percentage and worth 6.2%. A study conducted by Adam Pameresh found that significant relationship between BMI with endometrial hyperplasia and also malignancy. High estrogen level in the blood due to peripheral aromatizations of subcutaneous fat causes hormonal imbalance in the blood, causing a high rate of endometrial proliferation without being contracted by progesterone. This can lead to the appearance of AUB complaints due to the formations of the fragile and also easily bloody endometrial layer. This can also increase the risk of malignancy in obese menopausal patients. So the majority of AUB patients had merit and 89.3%. And the majority of AUB patients had a less education level of senior high school in 50.3%. A high level of education can support patients' awareness and also encourage them to undergo examinations and also treatments at health facilities, and also related knowledge about the reproductive systems, the menstrual cycle, early diagnosis, and also the better management of AUB. The majority of AUB patients had their first menstruations when they were over 12 years old. And the most parity of was found in women with multiparity and 40.6%. A study conducted by Barrett show if difference in ovarian functions concerning parity and the time of the last birth. The study mentioned that the follicular phase in multiparity women lasts 1 day longer than in nulliparity women. If estrogen level decrease, there will be no excessive endometrial hyperproliferations, which can result in AUB, a continued decrease in ovarian functions after childbirth, and also a reductions exposure to free estradiol can reduce the risk of malignancy that can lead to the AUB. Increase ovarian steroid level coincide with the increase the time of the last birth. So it can be assumed that a multiparity state that can reduce the risk of AUB incidence. Based on the palm coin classifications, the highest proportion of AUB incidence at Haji General Hospital was caused by the palm or structural club in 88.6%, and mostly is leiomyoma in 50.3%, and followed by malignancy. Okay, this is in line with research conducted by Rifki. So for the period for January 2013 until December 2014, showed some result in which the majority of AUB patients were leiomyoma in 56.86%. The high number of leiomyoma and also malignancy cases at Haji General Hospital was likely because the patients were generally referred from regional hospital. Haji General Hospital is a Class A general hospital and referral center for the North Sumatra regions and surroundings. So along with the development of the medical care provisions, because there are more and more obstetrics and gynecological specialists in the area who play a role in early diagnosis of cases of AUB and malignancy. So that referral are made to more competent health facilities when screening patients in regional hospital. So based on this study, it was found that out of 99 cases of leiomyoma at Haji General Hospital, just only 44 of them had a location interpretation determined from ultrasound, MRI, or hysteroscope examinations, and the majority of leukemia patients had the highest percentage in submucous in 38.6%. And also, this is in line with research conducted by Turkey and Cameroon, shows similar result and found that the majority of LA location were submucous. A study conducted at Army Hospital, Dr. Supran Malang, showed the same result and obtained the most locations in the submucous. This happens because the submucous leiomyoma is generally located below the endometrial and protrudes into the uterine cavity. So it is most often shows complaint of bleeding disorder, where compared to other type of leiomyoma, they are larger in size and do not show complaint of bleeding. In the study, the highest percentage of AUB patients received medicament therapy in 45.7% and followed by hysterectomy. This is related to the first-line management of AUB, which are oral supplements, a combination of oral contraceptive, progesterone, NSAID, antifibrinolytics, desmopressins that can provide hemodynamic stability, can improve anemia, and also can maintain the normal menstrual cycle. However, if medicament therapy fail or there are pathology in the uterus, such as large uterine fibroid, endometrial hyperplasia, and carcinoma, then surgery is an option, such as polypectomy, hysteroscopy, endometrial resection and ablations, myomectomy, uterine artery embolizations, and hysterectomy. So yeah, hysterectomy is the most common surgical procedure performed in gynecology. Although it is invasive, it was the definitive therapy for heavy menstrual bleeding. In addition, this procedure is permanent, so it is only indicated for women who do not need fertility in the future. It requires a longer recovery time and higher rate of postoperative complications compared to endometrial resections and ablations. Well, this brings me to the end of my presentations. The majority of patients with AUB at Haji General Hospital is in Indonesia in 2020 until 2021 were those who have the following characteristic: age 41 until 50 years, at Hanan obese BMI, marriage status, had a less education level of senior high school, had their first menstruation when they were over 12 years old, multiparous, and received medicament therapy. And based on the palm coin classifications, the most AUB cases was leiomyoma. Based on the classification of leukemia locations, was location where submucous. Therefore, it's urged for women who are over 40 years to be able to maintain their ideal weight because, yeah, this is the main risk factor of the AUB. So here are my reference list that I used in this slide. Okay, that's all from me. Thank you for your kind attention.